coding inaccuracies being a top reason for denials? And what steps do you take to work to reduce your coding inaccuracies?
Sure. Thank you, Marcia. Yes, we do continue to see an increase in our coding denials for both unbundling, upcoding, NCCI edits, and LCD edits. Through our partnership with Aidéo, we have been able to build rules to help address these issues, as well as leverage our RCM software for additional rules building and scrubs prior to the claims going out to insurance. This, in combination with our continued review of coding denials that we receive, allow us to build customized rules by insurance and by provider specialty to help reduce that overall impact in denials based off of coding.
Thank you, Sonia, for that. And quick apologies. It's Shabika Hooks. I realized I gave you a new last name, so you can take it or leave it if you want. Shabika, I'm curious, same question to you. How do you all handle inaccuracies and denials?
All right. First off, I want to keep the hooks. My husband would be upset if I drop that, so I better keep the hooks. So, but the coding inaccuracies are indeed a significant reason for denials. And to address this, my team and I focus on continuous education and training for our coders. We also implement regular audits and feedback sessions to identify any trends and correct any errors promptly. Additionally, we do leverage a pre-build technology to assist with coding accuracy and ensure compliance. So we build flags into that system, and I have several auditors that are called senior coders that audit those accounts before they go out the door, and that help us keep up with any inaccuracies and to again ensure compliance with the latest coding standards. And I think by combining those strategies along with what Sonia mentioned in regards to building, edits in place, I think we aim to enhance the accuracy and efficiency of our coding processes.
Great, thank you. I know that keeping up to date with all of the changes, I mean, it's a full-time job. So those are great strategies. I'm going to toss this over to Joanne. As Lexicode CDI leader and expert, what are some of the steps that you and your team utilize to reduce coding inaccuracies related denials?
Sure. Thanks, Marcia. And, I think that as we look at the continuum of revenue cycle, the CDI is critical because they are starting before the whole coding process. So the current goal of our CDI team is really to ensure that the medical record reflects the most complete, accurate picture of that patient's encounter. As they're doing that, they're reducing the complete documentation, which is very often a roadblock to accurate coding. So by having a clean medical record that's accurate and complete, the coders then are able to more easily accurate. So definitely there's that flow down effect to improving efficiency. Some of the work steps that the CDI team uses is make sure they're in cases every 24 to 48 hours while that patient's in the house. So that gives them an opportunity to query physicians promptly, making sure the documentation is complete. We also want to utilize our robust templates for querying so that we're being standard, we're consistent in our query process, which is also very compliant. But it also ensures that the process is efficient. We're not recreating the wheel every time. Documenting diagnoses, and that's an important piece of CDI, is conducting our clinical validations. So when we are documented diagnoses, we're still looking at lab values, imaging, exam findings, plans of care, just to make sure that those are supported are a high area for denials. Physician education is really key. We want to make sure that there's a healthy communication process with providers, that they know the mission and why, so that it becomes important to them to the document well. And then finally, really closing that HIM coding loop. We want a continuous improvement process that feeds to the coders and back to CBI and back to providers. There is definitely enhanced coding accuracy and minimal errors.
Hey, Joanne, thank you for that. I think you have a little bit of a weird connection. So I'm gonna, can you maybe move the antenna a little bit, try to log back in and come back on, and we'll come back to you, because I think you had some great information there that the attendees maybe only caught a little bit of. So we'll come right back to you once you kind of jump back in. But thank you. And I apologize for that. We all know how technology works. Great until you need it. So I'm going to throw that question over to Marcia and let her jump in and just kind of give an overview in your experience, in your role, how are coding inaccuracies, how are you handling them, and what are you seeing in your current role?
Sure. Thank you, Marcia. Having worked in the AI world with the direction of the coders, constantly teaching the system and monitoring the system, that creates a lot of consistency in what we see from the AI coding. And consistency is something that, as we all know, CMS and Medicare looks for in our coding and our submission of claims. So we don't deal with a lot of human errors. We deal primarily with AI errors. And when we do, in fact, identify errors, we're able to put those errors together because they're all consistently the same. So sometimes consistently wrong is better than not consistent. So even if we do have an issue or an error or a denial, it's easier for the system from an AI perspective to be able to identify those, figure out that problem, and correct all of them together as one group, as opposed to those individual denials that we get, and we have that pile of papers sitting in our in basket trying to get through all of them, or in our email trying to get through all of them. So that consistency is a big help, not only in not creating some of those denials, but when they do in fact happen, and being able to work them as a group rather than individual denials.
Okay. Thank you, Marcia. Joanne, let's go ahead and see, maybe just, I thought she was there. Nope. Okay. We'll wait for her. We won't wait for her, but we will certainly go back to her, because I did have the privilege of hearing the test run. So I think she has some good, insight to offer. But so I do have a follow-up question though for Marcia. Talk a little bit about the importance of the medical documentation. You talked about there's, that you do see some, inaccuracies, and, how does that impact the, how well the AI does? Can you share a little insight there?
Absolutely. Well, the old garbage in, garbage out definitely applies here. And a lot of times we do get clients that send us a large volume of data for our AI to look into and analyze and try to come up with what is correct coding. But if the coders at that facility or for that client have been coding things incorrectly, then guess what? The AI is going to code it incorrectly as well. So one of the things we really stress to our clients as they're coming on board is making sure that you have quality info, even if that means not inputting all of your data. We've actually had a couple clients that said, we have some coders that maybe haven't been our best. We really would like to not use some of their data. So they actually selected out that they called their top coders and said, we're going to give you just the data from those top coders. We know it's accurate. We know it's good. That's what we want the AI to learn. So I think it's choosing your documentation for input to get the AI started, and making sure that it's quality data, and continuing to make sure it's quality data, and making sure again, consistency is really important there, and making sure that any of the documentation that you're getting, again, the AI learns by that consistency. So the more consistent it is, the more the AI is able to code, and the more you're able to have done through AI technology.
Wonderful. Thank you. I'm going to throw one back to Shamika here. So along the, you had some great insight on how you manage all of that. How much does the documentation from the providers play a role in the inaccuracies?
So I think that improving documentation quality is a multifaceted approach, and we collaborate closely with our physicians and other healthcare providers to ensure they understand the importance of detailed and accurate documentation. We also recently implemented a physician advisor program within our revenue cycle. We usually see physician advisors in the utilization management space for like medical necessity denials, but we expanded that into our revenue cycle. And the physician advisor program leveraged our physician expertise to improve our clinical documentation, which also in turn helped with our revenue cycle management, which includes denials and patient care quality. And whenever I say we, I'm talking about coding and CDI. We all collaborate together with the physician advisor to provide regular training, education sessions, and we create easy to follow documentation guidelines and tip sheets for both the coders, CDI, and the physicians. Additionally, we also use technology to assist in capturing comprehensive clinical data, because there is a lot of burnout with physicians. They're concentrating on the patients and trying to make sure that they diagnose the patients correctly, and patient population and volume can be really high for physicians. So we did utilize a technology tool to assist them and give them alerts for more comprehensive clinical data. And this also helped in reducing any ambiguities and improving the overall quality of our documentation. And I think that this collaborative effort ensures that our coders have the precise information that they need to code as accurately as possible.
Wonderful. I mean, it seems like it's one big team effort. So that's fantastic that's how you approach that. Sonia, I'm going to give you the same question. I mean, we continually hear physician documentation being one of the biggest challenges. So how, you're in a little bit different situation. How do you all handle it?
Sure. And we kind of go at it twofold. So not only do we work with the AI team with Marcia on particular things that kick out within the documentation that create it difficult for the AI to pick up, but we also do education and training for coding guidelines and requirements, and work with the physicians for them to help craft better templates and to ensure that their templates have the phrasing and keyword indicators so that it is easier for AI to pick up on those particular items within the documentation. So it kind of is a twofold process where it helps AI, plus it helps train and educate the providers on what is needed in order to appropriately diagnose and code.
Awesome. And it seems like, between you and Shamika, there's a lot of things that you're doing to help the physicians, to allow them, to focus more on their, physician-y jobs than being in front of a computer. So excellent. So Marcia, I know we spoke a little bit about, some of the documentation, that can play havoc. So do you have any additional insights you'd like to share just on, the importance of, not even just an AI, just as your experience as a coder, that you've done that you want to share on how to, help physician documentation improve?
I would say the main thing that we see is monitoring, or not monitoring, perhaps would be a better way of saying that. So what we see is, practices get very busy. They don't have time sometimes to really monitor things. They don't realize there's a problem until there's denials, and then when there are denials, there's a stack of denials. So, auditing is very important, and keeping on top of things. And as Sonia mentioned, identifying that issue before it becomes full blown is probably the biggest and most important part, because once the denials kind of get out of hand, then it of course affects your accounts receivable. If there's too many for everybody to work with, then affects your accounts receivable even further. So monitoring and keeping track of what's going on and knowing immediately if there's a problem is probably the most important that I see.
Okay, thank you. Thank you for that additional information. Shamika, with your physician advisory board, does that include new physicians? Do you have anything like special education for, new doctors that are just graduating or coming, to your system?
So we started out with our hospitalists, and now we're starting to venture into residents. So when residents enter, we're starting there, but we did start with our hospitalists and kept the metrics there. And we have seen great improvement in their query responses, also in their specificity, and great clinical support to support the CCs and MCCs that are on the accounts.
Okay.
So we have seen great improvement in all areas, but we are again venturing out to do new positions, and we're going to do other specialties as well.
Okay, excellent. All right, well, moving right along. Again, I mean, this has just been really great. Our next question has to do with staying knowledgeable on coding and insurance questions. So I know, Shamika, you touched on it a little bit earlier. So I'm going to, can you talk through how you make sure that your coding team is, up to date on the new changes? Do you guys are they responsible for their own, CEUs? Is it something that you guys provide as an organization? Just how do you, keep up on all of that? Because I mean, we all know it changes on a dime.
So staying current with coding and insurance changes is crucial. And I feel that if you want a really highly advanced coder and to code correctly, and even in our claims to billing department, we actually make sure that we provide the CEUs for our team and pay for those. So we subscribe to education like industry newsletters, we attend webinars, and we participate in professional coding organizations such as AHIMA, AAPC, and CHIMA, the different states as well. And in addition to that, we also have a dedicated education team that monitors all regulatory updates, and they also disseminate that information to the team. And again, that is just not just include the coding team, but the CDI team, the claims and billing team. We also have revenue integrity team members, the auth team. So we want to make sure that everyone is updated on all those regulatory changes and guidelines that might affect their areas. And the education team also provide regular internal training sessions, and they do little mini workshops, and they are conducted on a monthly basis to ensure everyone is on the same page. In addition to that, we upload all of our educational sessions and workshops to a SharePoint page. So if there is like a new employee that come on board and they need to reference that material, or even if you looked at it, the first time, or you attended the session the first time, it's there as a reference if you want to go back and look at it again. And so those proactive approaches, I think, help us stay ahead of changes and maintain compliance, but also show our team that we are in support of their education and helping them, with providing those CEUs and paying for those as well.
That's awesome. And I know just a quick follow-up question, how does that work with, and how much do you rely on partners like Lexicode, for helping with education? Is there a good communication? How does that relationship work for you?
So I really rely on my education team to really get out there, look and see what's available. So if Lexico has something available, they make sure to incorporate it in our educational calendar. And we have set, we can't have because, coding is on a production basis. So we can't have all the coders taken away at one time. And so each coder have a day where they have their education. So like today, if today is Susie's day that she is, allotted education, and she's able to attend the Lexicode education. If not, we try to make sure that if there is a recorded option that we register, have that recorded option available, and we have links available on our SharePoint so anyone could go back and look at the recorded option on their day that they're assigned to look at education.
Excellent. Thank you. And I'm going to throw a shameless plug out there, but we are setting up 4 CEUs that we'll be hosting throughout the year. So please make sure you subscribe. And so you're aware these are free CEUs that we'll be providing, hosted by both our subject matter experts at Lexicode and Aidéo. So just a quick little shameless plug. So thank you for that softball there, Shamika, to throw that out there. I'm gonna, Sonia, what do you all do? How's that education process?
So we do have some very similar things to what Shamika has. Our compliance team actually handles all of our training and coordination. We as well pay for the CEUs for our coders, and also offer it for some of our AR and denial management team as well, depending upon what they work. One of the things that's very unique, I think, about our particular setup is we're multi-specialty. So we attend a lot of specialty-specific training and webinars so that we have specialized individuals within the modalities that our physicians practice. We also, our compliance team has found great resources on some of the major carriers' websites that we also set up training, because those are all online and webinars for our team, both our coding and our AR management team, so that they can help stay on top of those regulatory requirements that insurances roll out, because as we all know, every insurance is a little bit different. So you kind of have to make sure you stay abreast of any changes in policies that those insurances have. And we have found that it's a great resource to go out to their websites and see what seminars and webinars they are offering on specific modalities and training, because it helps you really reduce those coding denials and increase that documentation education to ensure that everything for medical necessity is being captured within the documentation that we're going to need for those billings.
Thank you. That's an amazing point there. Go directly out to the carriers, or if you work directly with, you have a representative from one of those insurance carriers. That's awesome. Joanne, hey, can you hear us? Welcome back.
Well, I can hear you. I'm not sure if you all can hear me though.
I think you're a little bit better. Why don't you stay off camera? That way it'll maybe help just a little bit with your with the connection. But let's go ahead and, Lexicode works with a lot of folks for coding in multiple states. So, kind of talk through how you handle education and making sure that, the teams are up to date, with many, multiple states, multiple insurance carriers.
Absolutely. And in both our coding, our CDI, and our audit team group, our education team keeps us very much updated. Of course, the same thing you all spoke about, the ICD updates are really critical from a state and payer perspective. We ensure that our local coverage determinations and national coverage determinations through Medicare are timely and updated for all of our teams. We definitely want to make sure that the CMS piece is key, because typically when we're auditing, we're adhering to CMS type guidelines, and while other payers are very similar, we want to make sure that we've got that CMS perspective. So all of those things contribute to us providing that accurate and timely coding and billing.
Excellent. And that's a good point. I mean, CMS does, dictate and control so much. So, that's a great thing to remember, to utilize what CMS provides, to everybody. Marcia, I'm going to, kick it to you, working with the AI, again, multiple states, how are some of the ways that you yourself keep up to date on changes, and what's the process on how that impacts, how the AI handles changes?
Sure. Well, we use a number of methods and resources for trying to keep up. From a AI perspective, the NCD, LCD type of edits are automatically loaded into the system. So it's not something that we have to worry about, did a human load them, and did they load them correctly, and did the CPT edits or updates get loaded on January 1st, et cetera, because all that's done basically automatically. So all that is loaded in the system. In addition to that, we rely heavily on coders, both from the client perspective as well as from the AI team, to provide any type of updates that they are aware of that are maybe specific, not to a state, but just to one carrier. So we constantly get requests for things like an insurance carrier that won't accept a diagnosis. It's not on the NCD or LCD list, but that particular carrier says, we don't like it and we don't want you to use it and we're not going to pay. So, once that information is given to us, and again, we rely on our clients and our coders to help us with some of those little, I call them idiosyncrasies, if you will, outside of NCDs, LCDs, etc. Other changes can be written into rules. So the AI has a rule system. The nice thing about rules is that you're not using a piece of paper or someone's memory. Those rules pop up specific to that carrier or that location or whatever it is. So it can be a CPT code that needs to be changed for a specific carrier for a specific location. And rather than having to keep track of that information on whatever, a piece of paper, an Excel spreadsheet, whatever it is, and the coder having to rely on that reference sheet or information, the AI is going to automatically bring that up and show that to the coder if it's a coder coding it or if the AI is coding it, so that the AI or the coder gets that information correctly. So I would say that probably the advantage of the AI as far as updates is getting them immediately and implementing them immediately. And again, not having to worry about whether someone has had a chance to load them or, oh, sorry, but Susie's out this week. She'll get them in next week when she gets back, those kinds of things. So knowing that they're going to be done on a timely basis and making sure that they're in the system.
Excellent. Thank you. All right. So our next question, we've been able to discern that our panelists, do take a different approach to their coding strategies. So Sonia, just starting with you, you're integrated with an AI platform. What was the strategy behind wanting to be integrated with a system?
Sure. One of our biggest reasons for wanting the integration with an AI platform was to help reduce our coders' time in production coding. So as I'm sure everybody has experienced since COVID, sometimes it's hard to find good staff and to keep your team robust. And so what we have found by leveraging the AI platform, we're actually able to reduce the time it takes us to submit claims because of how the AI is processing the coding. So we have increased automation, we have decreased production time for our coders, and then we were able to leverage additional rule sets similar to what Marcia was speaking to in order to decrease our denials. And it has actually given us a labor savings for that. And then we were able to take what our coding team was and shift them more to a quality control and a QA process, to where they're helping ensure that the coding that the AI platform does is accurate, is capturing. They're doing more of the provider education and training and things like that, and then assisting with anything that are the exceptions that the AI can't. So we have really been able to look at a smooth, streamlined process that has really helped us answer those kind of staffing problems that everybody has experienced, and to ensure that our claims get out the door much faster.
Okay, thank you. Thank you. Shamika, so you took a slightly different approach. You have your internal coders, you've also done some outsourcing, with Lexicode. So can you explain, why you elected to partner with, Lexicode, and then what your overall strategy in your coding operations is?
So partnering with Lexicode was a strategic decision to enhance our coding capabilities while also increasing our footprint for our facility. So we are venturing into other services and adding different hospital platforms and health plexes to our system. And so Lexicode brings a wealth of expertise and advanced technology that complements our internal processes. And so by outsourcing to a company like Lexicode, we can focus on our core operations while ensuring that our coding is handled by experts. And this partnership allows us to scale efficiently, maintain high accuracy, and stay compliant with industry standards. And we will eventually look into AI from maybe our ED platform, but because of the complexity of some of the inpatient accounts, we have not had luck with finding an AI tool for some of the complexity for assigning PCS codes specifically. So I think that our overall strategy is to leverage the strengths of Lexicode right now to provide the best possible coding services.
No, I totally get that. I mean, AI is, still really in its infancy. So, I mean, it's, it'll get there, but, I completely understand. So I'm going to jump back over to Joanne, and specifically, I mean, Shamika's talking about leveraging, yours, Lexicode's expertise. So how has that partnership, been over the history of your partnership, and kind of just tell us a little bit about the relationship and how you partner and why you guys are good partners together.
Yeah, absolutely. And I think that this relationship is very representative of how we work with so many of our long-term, and why they remain long-term clients. It's the breadth of our expertise, as Shamika said. It is the fact that we can be flexible and adjust staffing to meet our clients' needs, and also have that the scope where we can cover those complex inpatient cases, but at the same time backfill emergency department coding and outpatient surgery. With having over 1,000 coders, we're able to find the right fit for each client. And some of that might be our US-based coding, some might be more for our offshore coding teams. And then the fact that we offer clinical documentation improvement services, our formal audit services that assess compliance, that expands out what we're able to offer, and why our clients continue to stick with us, and why we're able to expand our client base as well.
Wonderful. Thank you for that. I'm going to bounce back over to Sonia. So, as you were talking about your coding teams, kind of going a little off script here. So, can you talk about, are you also employing similar strategies that Shamika and team are? Are you totally insourced? Do you outsource anything? You want to talk a little bit more about that piece of it?
Sure. So we actually have a combination of we have in-house coders and we have outside outsourced coders. So we actually start with the AI platform and allow them to kind of code what the AI is good at. And then it comes into our outsourced vendors that have specialty in those particular modalities. And then our coding team is more of the compliance and control and the QA processes and the exceptions to the rule. We are heavy in like orthopedics and surgeries and things like that. And so for some of those more complex cases, you really do need still that in-house coder with that specialty. But we really do a combination of all three to depending upon what type of specialty and modality that our provider is.
And that's you bring up a good point, Sonia, and I know that I'm sure we have several coders on this call. And I think you can see from both Shamika and Sonia here that, coders working with the AI is kind of where everything's going. I don't hear anybody saying we're never going to have coders. So I do want to stress that, being able to come up with a strategy that works best for your system is important. And you can see here demonstrated, they're varying strategies. So thank you for that. I'm hoping that helps, put some people's minds at ease on how, AI is going to come and take over the world. It definitely is always going to be a partnership. All right. Well, we're making some good time. So we have a handful of questions left. Again, just thank you to our panelists. Thank you to everybody who has joined. I'm hoping that everybody's finding a little bit of information to take back with them. So, speaking of coding strategies, we'll start with you, Shamika. How do you see coding evolving in the next 1 to 2 years? And speaking of AI and all that.
In the next 1 to 2 years, I see coding evolving significantly with the integration of advanced technologies like artificial intelligence and machine learning. These technologies will enhance the accuracy and efficiency of coding by automating routine tasks and identifying patterns that may be missed by human coders. But additionally, there will be a greater emphasis on real-time coding and documentation, which will also streamline the billing process and reduce delays in reimbursements. And again, I want to emphasize the role of the coder will also shift, but it's going to be towards more analytical and supervisory functions. So the role of the coder is not, like you said, is not going to go away. There's just going to be more analytical, more supervisory functions and overseeing the AI systems and ensuring compliance with the ever-changing regulations and making sure that AI is catching that information.
That is a great point. And I was on a webinar earlier today, and that, was reiterated that it's just nobody's getting rid of their teams. We're shifting. There's always work, some other place that they can lend a hand in. So great point. Sonia, for you, I mean, what do you see in the next 1 to 2 years? Not just in your own organization, but what do you think in general that coding looks like?
I have to agree with Shamika that I really do see the industry transitioning more to AI, especially as some of these physicians technologies on the front end, they actually utilize more AI type functionality to diagnose and review. So that's going to translate very well across to the coding and the documentation side of it. And it is never going to eliminate the actual physical coder that we're going to need. It is going to be for that quality control and compliance and education to continue to ensure that all of the regulations are being met, the documentation is there, and everything is actually talking the way that it's supposed to talk, and we're able to capture. I see that because of some of those, and we're going to be able to get some more consistency in documentation from providers because of those technologies, that we're going to actually see improvement on the denial side for that, because the reports and documentations are going to be much cleaner and smoother for those technologies to pick up and read as well.
Okay, excellent. Great insights. I'm going to throw it over to Joanne. How do you visualize coding changing in the next 1 to 2 years?
Yeah, I think that you might have a unanimous group here. I agree with Tanya and Shamika. I think, when I was speaking about CDI earlier, and I know there were some audio glitches, I did want to highlight that we're seeing so much advancement in what I call outpatient CDI, where traditionally CDI has occurred in the inpatient setting. The documentation improvement initiatives that are happening, especially 2024, moving into 2025, we're seeing a lot more activity on that front with our clients. And I see that as continuing. I believe that the intelligence, the autonomous coding and documentation improvements are going to further support all of those initiatives, and the result will be seeing fewer denials as well as improved coding accuracy.
Okay. Has anybody started or with any of their coders? I know like AAPC has started to offer, AI coding certificates. Have you guys, have any of your coders started taking those courses? Is that something you've looked into? Shamika, I'll let you go first.
I have been made aware of the AI programs by AAPC, but currently my team has not taken advantage of that yet, just because in the mid-cycle, we really have not ventured too far into AI, because just talking to other organizations that have a similar coding, one of the team members said they had to back out AI in their organization. So I'm just trying to wait until the right time, but I am aware and will venture into that, once we get a little bit more comfortable.
Okay, excellent. And again, just reiterating a couple of questions ago about the strategy. I mean, each individual organization, you got to figure out the strategy that's best for you all, and when you jump into the world of AI. I'm going to pivot over to Marcia. Have you yourself looked into, taking any of those certifications, or, have you seen, any of your colleagues venture into that world of AI certification?
I have seen a couple of the coding organizations offering the certifications for that, but I have not actually spoken to anyone that has actually completed those courses as yet. I think it's definitely something that I kind of think of it as 20 years ago when health information coding, etc. And, we had a lot of non-certified coders, etc. And I just look at that as a process of making sure that all the folks that get involved in AI kind of know what they're doing, if you want to call it that, as opposed to just, throwing people into it. So I see it as, the world 25 years ago where anybody could be a coder, and that didn't necessarily mean they were a good coder. And then, we had a HEMA really ramp up and AAPC ramp up to where they offered certifications and specialties and core credentials and what have you, to try to ensure that our coders were a lot better quality. So I think having that AI certification kind of ensures a little bit more quality. And as we get into AI, I think the biggest doubt we have about AI is, as you said, Marcia, is, oh my gosh, it's going to take over the world. We've got to control it and not let it control us. And that means that we need to know what it's doing and how it's doing it. And we all need to be knowledgeable in that. And so I think that's going to be a very, very important component. The other thing I think that AI gives us is the opportunity that perhaps we haven't had in the last 20, 25 years. The way we got in the situation of increased denials and, not enough coders, et cetera, is the fact that we just haven't had the time to do everything that needs to be done. And this is going to give us that opportunity. If we can get the AI to code whatever it is, 25%, 50%, 75%, then that means that all that time our coders can now work on the things that we need them to work on, that they have the expertise to do, whether that be auditing the AI, whether that be work in denials, whether that be work in the extensive cases the AI is not able to handle, which the coders haven't been able to do before. They just didn't have the time. The clients just didn't have the staff to do those things. And so the denials piled up, and the AR went up. All those things happen, but I think AI is going to afford us the opportunity to be able to have that time to do it and do it right.
That's some great insight, especially on, I think a lot of folks are still, oh my God, what's this AI going to mean for me? So that may explain why it hasn't picked up, as of late. All right, couple more questions. So Sonia, in terms of coding in general, I mean, we've talked about several challenges that we have, from documentation to people. I mean, have we left out any other challenges that you're facing that you want to share any insight on?
No, those are really like the top kind of concerns. The only other thing that I would say is communication. Communication is key with everything, but ensuring that you have a strong communication pathway for both your coders, your AI team, and your providers, so that you're that pivotal, integral component of making sure the proper communication is passing back and forth, because without that, it creates gaps in areas that just creates more denials, to be quite honest. But by ensuring that you have those really good communication processes already lined out, so that you can take what the AI team is telling you, what your coders are telling you, what you're getting from your physician, and getting everyone on the same page, that has probably been one of the big things. That it's great to have education. It's great to make sure your coders are trained. It's great to make sure your AI is trained, but you have to hit all key components and get everybody on the same level playing field, to just ensure that quality is being met.
Okay, wonderful. Shamika, do you have any, last minute thoughts on other, coding challenges that you'd like to talk through?
No, I echo Sonia, and I think we already kind of touched on, one of the top challenges, and that is just overcoming, the, incomplete clinical documentation. So we just need to ensure the accuracy of our clinical documentation, because, inaccurate or incomplete documentation lead to coding errors and subsequent denials. And again, the top thing for addressing that is ongoing training for our coders, and closely collaborating with our providers. And like I said, one of the things that we're utilizing is our physician advisor program in revenue cycle to assist us with collaborating with our providers. Another challenge that we already touched on is just staying up to date with the frequent changes in coding standards and regulations. So, we touched on that. And then, just making sure that we are monitoring those updates, those changes, those payer policies, and just making sure that we're conducting regular sessions to keep the teams informed and compliant. So I think we've touched on many of the major challenges.
Mm-hmm. Okay, awesome. And that was a great recap for everybody. Thank you both. We have a couple more minutes, so I really want to get this one in for Sonia and Shamika to answer, and then we'll wrap up. But again, thank you both for being here, and you both have phenomenal resumes. You both run excellent departments. So I'm sure we have some folks on here that are looking to grow into a role similar to what both of you have. Sonia, we'll start with you. What would be one piece of advice that you would give to somebody that's, newly in a director role, leadership role?
I would say probably my one piece of advice is constantly going out to keep your thumb on the pulse of what's going on, because in healthcare, it is ever changing every single day. Finding a good network and good partners that you can also rely on for expertise and communication to be able to, spin ideas and to communicate about what's going on, what kind of struggles you're having in the practice, what you're seeing on the horizon, and ways to help build that. I am a big proponent of also going to school, finding those courses and ensuring that you get those certifications and those areas that you are really looking to grow into. And I will speak from my own personal experience, having a great mentor, finding someone that will take the time to mentor you and help explain whether it's coding or whether it's revenue cycle or whether it's business development, kind of helping walk through those kind of things. And I had a really great mentor that was outside of the company I worked for. And it was great to be able to have that person to reach out to help spin ideas and get feedback on where I was at in the track that I was taking whenever I first started getting into healthcare and into this field. And those are the things, you can't replace the people in the networks for sure. And the expertise that they can help build and grow you with.
That's great. And I know, for you, those that are on the webinar that, are members of local AHIMA or AAPC, get involved, get on committees. That's going to help as well. That's some fantastic advice. So like in the next 2 minutes, Shamika, give us your advice that you would give to a young leader starting out.
My advice to a new director would be to prioritize continuous learning and adaptability. The healthcare coding landscape is constantly evolving, and staying informed about the latest trends, technologies, and regulations is crucial. And invest in your team's professional development. You're only as good as your team is going to be. Like, you're going to be held accountable if your team is out here making a lot of mistakes. So, invest in your team's professional development and create a culture of continuous improvement. Additionally, foster a strong communication and collaboration within your team and with other departments, because you're going to be the go-to, when other departments, feel like, the quality scores aren't looking like they're supposed to, or they're thinking you're coding things wrong. So, collaborating with other teams and being open to accept that feedback, and then building a supportive and knowledgeable team will help you navigate challenges that you have no idea is going to come your way and achieve success in your coding operations. Because again, you're only as good as your team.
That is also fantastic advice. Wow. This has been great. I appreciate the opportunity to moderate, because you all have provided so much information. I hope everybody listening gets, at least one or two things out of this session. We do have some questions. We will get to them. So we'll send out answers to all of our questions afterwards, as well as, notes and recordings, all that fun stuff. So I just like to go ahead and wrap things up. We have just one slide we're going to toss up, and I'll go ahead with closing remarks. Well, while we're waiting to get our slide up, I think there we go. Now we're coming. I just wanted again, thank everybody. I hope you all enjoyed this discussion as much as I enjoyed moderating. I know we probably could still be going on. So just great knowledge. We heard from our industry partners and PCH coding leaders. As a reminder, coding is just one piece of the PCH Global. Throughout the course of the year, we hope you join us as we take you on a journey of our PCH ecosystem, beginning with our next webinar. Again, that's Tuesday, April 23rd, same time, so 1 p.m. Central. I'm on East Coast. And that session, we are going to talk about denials management. Each of our webinars will be showcasing our customers and how they are utilizing our relationships and connections with payers to assist with their denials management, prior authorization, and reimbursements. Again, I want to thank everybody for taking the time to join us today. I especially want to thank all of our panelists. I just blown away by everything shared today. So again, thank you, ladies, for your time. Thank everybody for your time for joining. And I look forward to seeing everybody on our next webinar. I hope you guys have a great rest of your day. Thank you.